Hey everyone, today I want to talk to you guys about lower back pain, in particular chronic or reoccurring lower back pain. This is something that I myself suffered from for many years, and my first doctor told me that this is something I would live with for the rest of my life. And after trying several different physicians and finally going to a chiropractor, it's the reason I got into weightlifting in the first place, and now I'm on my journey to becoming a strongman. So what I've been doing is going through a lot of clinical studies, comparing various types of exercises and treatment plans for lower back pain and their results. And so I'm going to try and summarize these and go through these as quickly as possible so you can have a good idea of what you need to do. Now, a low back injury or lower back pain is going to happen to 80% of people in their lifetime. That 80%, 7 to 10% are going to develop chronic lower back pain. Of that, 1% will end up getting some form of physical disability caused by the lower back pain. So what is said a lot, I've been told this by 3 different doctors and a chiropractor: your core's weak. And what do we think? My abs. Every time somebody says core, you think abs. Maybe you think obliques, but you don't think of the whole picture. That's not your core. Your core is your abs, your obliques, your intra-abdominal muscles, and your lower back muscles. That's your core. So just to prove that, there's actually a study on the effects of the ab training. This is the name of the study. Does strengthening the abdominal muscles prevent low back pain? A randomized control trial. So they had 402 people sign up for this study. And unfortunately, unlike a lot of these other studies, it was not really controlled. What they did is they gave their experimental group a list of abdominal exercises. Now, these were all exercises that could be done at home, no resistance. They were some form of sit-up or crunch that they were supposed to do. And then they kept track of these people over 2 years. And here's the results of that study. So this is abdominal strengthening to prevent lower back pain. There were no statistically significant differences between experimental and control subjects at 24 months for lower back pain episodes. Over 2 years, these people that were doing crunches didn't have any improvement over the people doing nothing. Their conclusion, though, was pretty interesting. Back education and abdominal exercise instructions are similar to back education alone. There were no group differences in lower back episodes, possibly due to non-compliance with the exercise program. You think, guys? You tell people to go home and do crunches, you think they're going to do it? How many people do the New Year's resolution? I mean, that's probably significant. So that wasn't really a good study, and they straight up said that they needed to do further analysis on that, and there hasn't been a new study on that I could find. So the next one is the effects of core exercise program on pain and active range of motion in patients with chronic low back pain. Now this one, they actually used a modified abdominal respiration technique for their core workout, which was described as a type of yoga movement. Now, if you do not know this, yoga uses all of your core, your back, your abs, your obliques. It's going to use every muscle in your body. They did 30 minutes 3 times a week for 4 weeks. So very short period of time. Now here's the results of the study. Increased visual analog scale at rest and during movement. The pain pressure threshold of the quadratus lumborum was significantly increased, and their active range of motion of their trunk flexion increased significantly. So what does that mean? Well, they had a higher pain tolerance, or they were feeling less pain, and they improved their range of motion. So just that 4-week program of the core training yoga type, no weights, they improved. That's good to know. The problem with this study is they only had 30 patients, and they split it into 15 in the control group and 15 in the exercise group. So I found a meta-analysis of core stability exercise versus general exercise for chronic low back pain. What they did is they reviewed all sorts of different studies, and they picked five trials. And these 5 trials focused on core workouts. That's how they narrowed it down. And there were a total of 414 participants. Pooling revealed that core stability exercise was better than general exercise for reducing pain and disability at the time of a short-term follow-up. However, no significant differences were observed between core stability exercise and general exercises in reducing pain at 6 months and 12 months. So in the short term, that's very similar to the one that we just went over the 4-week period. It does reduce back pain and improve your range of motion. However, 6 months and then 12 months, you're not getting any benefit over just general exercise. So you're not improving, your lower back pain is not going away, you're still suffering. So let's go and look in some other studies. And the first one is the clinical effects of intensive specific exercise on chronic lower back pain, a controlled study. Now I like this one. There were 895 consecutive patients. And they did a 1-year follow-up. So this wasn't just a short-term study. What's interesting is only 625 of those 895 people completed the program. 167 dropped out. And a lot of them dropped out, they said time, and some of them were saying they didn't improve, but they only gave it 1 or 2 weeks. And they had a control group of 107 people. On average, all of these people had had symptoms for 26 months. All of these people had been, on average, to 3 previous providers for evaluation or treatment. Sounds like me. 2 diagnostic tests and 6 different treatments. Several of them had had surgery. 89% had failed a supervised exercise program. Fancy word for rehab, right? 47% had gone to a chiropractor and it did not help their symptoms. What they did is they exercised 2 times a week for an hour. Now, they did a focus on lower back isolation movements. However, they did do some aerobic exercise, and they did some strength training of abs, hamstrings, and glutes. And this is what they said. Previous studies have shown that in patients with chronic back pain, the lumbar extensor muscles are more likely to show relative weakness than the abdominals. So if you're suffering low back pain, chances are it's your low back that's weak, not your abs. Therefore, efforts at strengthening were concentrated here. So they focused on the low back. And what they found in the initial study, on average, range of motion increased 17%. Dynamic strength of the lumbar spine increased by 44% in males and 47% in females. Work capacity of the torso rotation increased 51% in males and 77% in females. That's huge. And at the beginning of this study, 602 people listed back pain as significant. Obviously, because they've been going to all these different providers and trying all these different things. After the training, 64% noted a significant decrease in pain that was dynamic. 15% said it decreased. 6% said it decreased slightly. 12% said no change, and 3% said worse. So that's back pain. 85% people improved between slightly and a whole lot. 429 people complained of leg pain. Now that's pretty interesting. If you have a spinal injury, of course that can radiate down your legs. Sciatic pain, all that kind of stuff. 62%, again, substantial. 17% improved. 6% slightly. 13% no change. 2% worse. Again, 85% improvement. That's pretty good. Now this one was perceived functional response. So how did they feel that they were doing at moving around and doing things? How much more functional were they in day-to-day life? 71% substantial, 22% somewhat, 7% no change. 93% said after the strength training routine, they felt better. Now, what the people did that were running the study is they rated it. Overall response. Excellent and good means that you improved in all areas. Fair is maybe you improved in one area, and poor you didn't really improve. 46% were excellent, 30% were good, for 76% that are really showing good signs of improvement. 14% fair, 8% poor. They gave these people, after the initial period, a device to take home, a workout machine. 53% of those people say they used it. 47% did not use it. Of those people, 94% after 1 year of the people who said they were good or excellent, so that was that 76, still had improvement. They were still getting better. They still had a reduction in pain and improvement in mobility. Of those with only fair or poor results, 25% reported improvement, and 75% said that they were the same or worse. So that's a pretty strong indication that the low back focus exercise worked pretty well. Now, what they used was a special machine that anchored the pelvis in place. And what they had found was that these back extensor machines, they have the pad in the back. You sit down and you kind of lean back. You're just doing back extension. The ones that did not isolate the pelvis would not activate the back extensors. So they had to find a special machine to use for their studies. And I believe the name here was the MedX lumbar extension machine. They found things like the Cybex Eagle and the Nautilus lumbar extension machine were completely ineffective. So let's look at one of the things that I really want to go through here. This study suggests that not all exercises are created equal. It appears, in fact, that much exercise done is worthless for this group of chronic patients. It is our opinion that this is because so many patients did not follow through on their exercise or stopped exercising at the first hit of discomfort, believing that they were doing damage. So this is talking about all those failed treatment options before they came into this program and how many different people they were going to see. Many, if not most of our patients, initial periods of discomfort as they vigorously exercised a weak and stiff lumbar spine. Their discomfort was not unexpected, but it was amazing how many patients had been advised to continuously decrease their activity levels and let the pain guide their activity level. Does that sound familiar? This sounds familiar to me. Such patients became conditioned to avoid pain. This causes more deconditioning and more dependence on the healthcare system. Their muscles in their back were suffering from atrophy, and they were constantly losing muscle because every time they felt even a slight bit of pain, they stopped. So they stopped moving more and more. The next one, what do we do if we don't have these machines? Clinical trial of intensive muscle training for chronic low back pain. This had 105 participants, and what they did is they compared 3 different groups. So they split those 105 people into 3 groups. The first group did 50 sets each of hip extension, back extension, pull downs. So these are all things that you can do in the gym or at your home. 3 times a week for 4 weeks, and then 2 times a week for 8 weeks. Then they had another group do the exact same exercises, but they only did 20 sets. So 50 sets versus 20 sets. That's a lot less volume and intensity in the second group. And then there was a group doing a month of thermotherapy, heat, massage, and mild extension exercises 2 times a week for 4 weeks. The month of doing the heat therapy and all of that, no improvement. The less intense group showed some mild improvement, but not enough to be statistically different. The high intensity group had increased endurance, increased back mobility, reduced pain, reduced disability, and physical impairment. Again, that ties in with the study, and that study actually references this as one of their sources and says that while this is still effective, if you can isolate the pelvis while performing lumbar extension, you will increase the strength of those lumbar extensors that much more. The next study is physiological and psychological benefits. Lumbar strengthening in chronic low back pain patients. Now in this one, they took 54 low back patients and put 31 of them in a 10-week exercise program and 23 of them in a waitlist program. Now what I thought was pretty interesting about this, I'm going to try and go through this fast, is every single one of these 54 were referred by an orthopedic surgeon specializing in spinal disorders. They were having average back pain for 8 years, 2 surgeries or less, average age of 45. 54% of them were on workers' comp or disability, had an average time off work of 37 months. And 83% of them had low back pain that began from an automobile or work accident. And every single one of these people had some sort of diagnosed problem with their back, and many of them had multiple. So what they did is they exercised these people 2 times a week for 4 weeks and 1 time a week for 6 weeks. They were focused on the low back isolation. So again, trying to isolate the pelvis using that same type of machine. Well, a little bit different than the last study. These people used 1/2 of the person's peak isometric strength on the machine to do reps with. Anytime that they got to over 12 reps, they added 5 pounds. So you're doing progressive resistance there. You're adding weight continually. Results indicated a significant increase in isometric lumbar extension strength for the treatment group and a significant reduction in reported pain when compared with the control group. Treated subjects reported less physical and psychological dysfunction. There were no changes in reported daily activity. So they weren't doing anything else. This is the only thing that they were doing in this study. So these results show that lumbar extension is beneficial for strengthening the lumbar extensors and resulting in decreased pain and improved perceptions of physical and psychological distress. So it's good for your mind, good for your body. Their lumbar strength was 20% when compared to a general person without lower back pain or issues, and it increased from 20% to 42% over this 10-week study. 10 weeks! And this much improvement. That's amazing. Last study that I want to go over in isolation of the lower back. Low back strengthening for the prevention and treatment of low back pain. So this is, they take a bunch of different reports, analyze them, put them together, and come up with a result. So what did they get? Research has shown that lumbar extension exercise using progressive resistance exercise, meaning you're increasing the weight, significantly increases strength and decreases pain in chronic lower back pain patients. It appears that lumbar extension exercise with the pelvis stabilized using specialized equipment elicits the most favorable improvements in low back strength, muscle cross-sectional area, and vertebral bone mineral density. So it actually increases the density of their spine. Low training volume, and they used 1 set, 8 to 15 reps, one time a week to come up with this, again, using all these different studies. Improvement occurs independent of diagnosis. So regardless of what was causing their lower back pain, improvement was noted. The improvements are long-lasting and appear to result in less reutilization of the healthcare system. So you don't have to go back to the doctor. Low back strengthening shows promise for the reduction of industrial back injuries and associated costs. So right there, you have it. Strengthening the lower back through back exercises that strengthen the lower back is the #1 way to reduce chronic low back pain. And it works regardless of what you've been diagnosed, according to all these studies. So if you can't afford the machine, as I said in those studies, you can do things such as back extensions, reverse hyperextensions, pull downs. All of these things are working in the back area. And even deadlifts. Now I wanted to just mention a deadlift. Unfortunately, this wasn't a very big study, and it was an A/B test, which means there was no control group. It was just their perceptions of themselves. And it was what patients with low back pain benefit, what patients with low back pain benefit from deadlift training. So they did 8 weeks. They did 3 people. 3. That's not very many. Participants with less disability, less pain intensity, and higher performance on some sort of test, which tests the endurance of hip and back extension muscles at baseline benefit from deadlift training. The pain test was the best predictor, followed by pain intensity. It's the Bering-Sorensen test. That's the #1 predictor. So before prescribing deadlift to individuals with mechanical back pain, it is important to ensure clients have sufficient back extensor strength and endurance and a sufficiently low back pain intensity to benefit. So in these people, there were 2 with persistent back pain and 1 had arthritic back pain. Now, the person with arthritic back pain didn't have any changes. And the 2 people with persistent back pain noted a huge improvement. Now, there was a study, listed in the study, the type of arthritis in the back depends on whether or not this type of exercise is going to help you reduce pain, because arthritis is a little bit different than a lower back injury or atrophy of the muscles in the lower back. So that's very important. Now, why is it that the core strengthening didn't continue to work at the same rate as all these lower back tests? Well, the first one is every single one of the core tests were done with no external weight. They were all body weight. Your body adapts to the stimulus placed on it. So when you start doing yoga, you start doing all these core exercises, it starts out hard and you're building muscle, you're building endurance, you're building strength, but then you adapt. And continuing to do that does nothing. So in all of the tests that were successful, they continued to increase the intensity, the weight, the reps. So in order to improve, you have to continue to add weight or resistance or reps, something to challenge the body to continue to strengthen itself and grow. So I'm going to go over real quick in the picture. Here are the back extensor muscles that we're talking about, what you have to strengthen. All right, here we have the back extensors. On the right-hand side, you can see the erector spinae there, made up of 3 different muscles. Then you have your deep extensors, your rotators, and your intraversi and your quadratus lumborum. These are all important for the back extension. And I'm going to link all the studies that I'm referencing down below. If you have any questions or would like any follow-up on this, let me know in the comments. And please, guys, subscribe to the channel, like the video. I'm going to try and do more information like this and post it out here at least once a week. Thanks. Have a good one.